My name is Violiza Inoa, and I do stroke and neurointervention here at Sims Murphy Clinic. I come from the Dominican Republic. My father is a physician, so I was always exposed to medicine growing up. I was interested in science, but I think what called me into medicine was more of the fact that I knew that I lived in a country in need. As years came along, then I discovered neurology and I found my passion. I genuinely thought neurology was the coolest thing on earth. When I was rotating in the hospitals, I saw a lot of patients, specifically stroke patients, and I realized that there was not much that was being done for these patients back home. So we came to the United States where I became a stroke neurologist. At that point, I felt that I could combine, my passion for education, for primary prevention, to be able to give back. I've been part of the Sims Murphy team since late 2016. So I was hired to this multidisciplinary group, which I find amazing. We offer all sorts of treatments for neurovascular conditions. We have people with neurology background like myself. We also have neurosurgeons. We have neuroradiologists as part of our team. I think that makes our team very comprehensive in terms of the diagnosis and treatment of cerebrovascular diseases. So most of the time I'll see patients acutely when we are in the hospital. That is the majority of my work. And these patients come in with an acute stroke, and we identify the stroke right away and we treat the stroke right away. And there are different types of treatments that we offer for stroke patients. We offer the clot buster medication or the thrombolytic, and when it is needed, we offer the thrombectomy procedure to get clots out when that is what's causing the stroke. So those are considered minimally invasive procedures. We select vessels from the wrist or from the groin, from the leg. We go to the brain and we get that clot out. And it's essentially one of the most efficacious procedures in medicine. We also take care of the patient while the patient is in-house, meaning hospitalized. We make sure that that patient gets the care that is needed after the stroke, and we focus on the identification of the stroke reason, the etiology, just to make sure that this does not happen again. We follow patients years after they have a stroke to make sure that they're compliant to the medications and that they are getting the medical care that they need in order to prevent another stroke, which is called secondary stroke prevention. We can see patients actually improving on our tables. People that were not talking, they start talking. People that were not moving, they start moving. Doesn't happen all the time, but we see it frequently, and it's remarkable what can be done. Obviously, you need the personnel, you need the expertise, you need the equipment. And the reality is that stroke is a treatable condition with the clot buster medications and when needed with the thrombectomy procedures. However, the stroke is also a preventable disease. Blood pressure management, medications, diabetes management and medications, smoking cessation, having a good, healthy lifestyle, exercising. In the United States, stroke is the 5th cause of death, but it is the 2nd cause of death in the world. Through international organizations, I've worked with Mission Thrombectomy, and now I'm working with the World Stroke Organization. We are setting education in mechanical thrombectomy for physicians that can perform the procedure, meaning international neurointerventional doctors, so they can feel comfortable with the techniques and they understand the perks of the procedure and also how to triage these patients and how to care for the patients after the procedure. All of that is available in many of these countries, yet the procedures are not being done. So that's why we think that with education, letting people know that these procedures can be done, how we can triage these patients, how we can take care of these patients after the procedure, then the hope is that the treatment gap decreases and that we can do more procedures around the world so people can be treated equally across the globe.